visualizing how range of motion is different from stretching, and demonstrate a couple of techniques that can actually increase range of motion. Providing passive range of motion simply maintains the range that is currently available in the joint. Even active assisted range of motion, you're only going to get the available range of motion that that person can move actively. Stretching is a whole different ballgame. Stretching of a joint allows the opportunity to increase the available range, but this takes time and some expertise and some use of your hands and knowing how to manipulate the body and the muscles in order to foster that to happen. So here we go. We're going to be talking about first, when you're doing stretching activities or to increase range of motion, you really want to look at and be cognizant of the alignment of the joint. Where is the joint in relationship to the other joints? Is it properly positioned? Does the alignment allow for stretching safely? Remember torques and forces and things of that nature and dislocating forces so that you don't do the wrong thing to those joints. So stretching can be dangerous. You have to do it slowly and carefully. Remember, you are not doing it on someone who's an athlete at this point. You are doing it on someone who has a disabling condition. The second thing that you need to be really cognizant of is stabilization. What are you stabilizing? Remember, the same rules apply with stretching as it does with range of motion. You have to stabilize above and below the joint at all times in order to preserve that joint and to protect that joint. Obviously, sometimes stretching can be uncomfortable to the patient, but it should not cause sharp stabbing pain. That means there's nerve involvement and you need to stop immediately. An aching pain or a pulling type of pain, discomfort, I'd rather say, is more appropriate, and you can continue forward cautiously. So that is the big delineation there, is if you have a sharp stabbing pain and the patient complains of that, you need to stop immediately. It means there's nerve involvement and you aren't going to do any good or any benefit to the patient at that point. The last thing that you want to look at is intensity of stretch. You want to hold a stretch for prolonged periods, which means you have to have the patient in a comfortable position and yourself in an anatomically sound position so that you don't compromise your own body mechanics and get hurt yourself completing these. And sometimes with tonicity and things of that nature, it takes a lot of strength to do stretch. So you have to be prepared for that as well. I'm going to demonstrate a couple of different things that you're going to find in your lab. This is not obviously an exhaustive tutorial on it, but it is a couple of, just to give you a sense of what you can do to increase the availability of range of motion of a certain joint. The first one that I wanted to talk about is hold, contract, and relax. It's a PNF technique. So it's hold and relax actually is the first one. The second one that I'm going to do is called hold, contract, and relax. I kind of like these a lot because it really involves the patient and it puts them, makes their muscles move and be available. What you really want to do is kind of stimulate the muscle, make it work a little bit, and then generally if it's around those joints, you really have to know which ones you're facilitating, you can get available range. And let me demonstrate that. So the first one is hold and relax. I'm going to do the lower extremities because it's a little bit easier. And the first one that I want to do is generally a lot of people have a lot of deficits moving in, having their knee and their foot into extension. If I have Ellen at almost full range, contract her muscle, contract, 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 and then if I say, okay, relax, I should get, there it goes. There's more available range of motion, say for knee extension. So let's try that again. I'll demonstrate each one, maybe twice. We'll see how it rolls. What we're going to do is we're going to have her contract the muscle in as far range of motion that she has, and then she's going to relax, and I'm going to see the available range. I went right up in the air. So you're going to see that knee extension occur more often. The other thing that I really, really like, I'll take her other leg just for fun, give this one a rest, is it's called contract and relax. So then what I like to do with this one, I really like to do the low back with this one because a lot of people have a lot of back pain. What I have people do, and it takes a little bit of strength, so I'm ready because she's probably going to kick me off the back. Let me get ready. Okay, notice above and below the joint as I have her push against me. Push, 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 hard as you can. Come on, come on, come on. And then relax. Notice the range. Okay, so you're going to see a bigger one. Let's try it one more time. So ready, go. Push. Hard as you can. And relax. and you get more available range. So notice how I'm going down even further. That's really good for low back pain for a lot of patients, especially if they're suffering. So that's hold, contract, and relax. The next one, you please sit up at the side. The last one I'm going to talk to you about is applied sustained pressure on a tendon. This last one is, okay, let's take the biceps brake guide, for example. Can you make a muscle? You'll notice her biceps brake guide, the tendon for that, it goes into that aponeurosis in the forearm, so that's where it inserts. But if you'll notice, and you do it on yourself, you're gonna feel a really hard tendon. If a person, and it sounds painful, so be careful, you can, I like using my thumb, you have to be gentle about, is applied sustained pressure on the tendon. If you do that and you support a little bit above the joint, eventually you're gonna get some extension, but this can be painful, so you have to be really, really, really careful of that. This is a really good spot to try it. Also, the Achilles tendon is a good spot to try it, and the gastrocnemius muscles are a really good spot to try it. Those hamstring muscles, those are really good. You can feel the tendons there the best, and that's a good place to do it. That ends this video clip.